Welcome, friends, to Faith in Healthcare, where we continue to explore the issues that matter most to Christian healthcare professionals. So whether you are in healthcare, married, or otherwise connected to someone who is, or you're just simply interested in how God is working through Christ followers in patient care and beyond, we're so glad that you're here. In this episode, we're joined by two leaders from AdventHealth who have spent decades thinking deeply about the well-being of healthcare professionals. And they are Dr. Ted Hamilton, who's a family physician, a longtime mission executive, and national voice on clinician well-being. He's joined by Dr. Carla Park, who's the Vice President of Whole Person Care, Education, and Integration. Together, they led a new peer-reviewed study of CMDA members published in the journal Religions 2025. It revealed something striking, that Christian healthcare professionals reported significantly lower burnout than the broader healthcare population. And there were three factors that tended to rise and fall together in those who were thriving. And those are belonging, calling, and virtue. Through practical insights and their personal stories, Drs. Hamilton and Park highlight for us how faith not only sustains healthcare professionals, but also equips them to lead and care more deeply for their patients and their colleagues and themselves. So let's dive in. Well, today on Faith in Healthcare, we're going to be discussing the significance of faith in healthcare as it relates to the well-being and the flourishing of those who are the professionals within healthcare. And joining me today is two professionals from AdventHealth System, Florida, who have been thinking a lot about this in their careers. And my first guest today actually has been with us in the past and talking about all around this subject of well-being, and that's Dr. Ted Hamilton, who's an MD, graduated from Loma Linda University School of Medicine, board certified in family medicine, and has practiced both rural care, primary care, and then a residency program director, has been involved in clinical and administrative leadership, and has been married to his dear wife past 50 years. So he's obviously had some well-being in his married life. So Dr. Ted Hamilton, thanks for coming back and joining us on our newly rebranded Faith in Healthcare, the CMDA Matters podcast.
My pleasure. Thank you for the invitation.
Now, Dr. Hamilton said he would only join me on one condition, that Dr. Carla Park, who's a PhD, who is a teammate there at AdventHealth, could be a part of this interview. And as we're getting started, we think that he tried to sabotage his sound because he wanted Dr. Carla Park to have most of the contributions to this conversation, but we're okay now. Dr. Park is Vice President of Whole Person Care Education and Integration at AdventHealth Corporate, involving both mission and ministry, and has taught whole person care in medical school and residency programs for more than 20 years. So welcome for the first time, Dr. Park, to Faith in Healthcare.
Thank you so much. I'm so glad to be here.
Now, Ted, I remember you're the very first ever Chief Mission Officer that I've ever met. I'd never heard that title before until you joined us a couple of years ago on CMDA Matters. Are you still Chief Mission Officer, or did Carla inherit this title, or somebody else got that title?
I retired 2 years ago, and they gave me sort of a title so that they could keep me in groceries for a period of time. And so now I am the chief specialist or something like that for well-being, physician well-being. So that's who I am now. I'm no longer chief mission officer.
Well, my only regret today, Carla and Ted, is that we are not having our director of our Center for Wellbeing, Pastor Burt Jones, who I told you earlier has gone on to what he calls his dream job as Director of Alumni Relations at Asbury University. But Burt came to me, Dr. Hamilton, just about a year and a half, 2 years ago, and said, Dr. Hamilton has a great idea, and I hope you'll say yes, Mike, and that is to survey our CMDA members because they seem to you to be so full of joy and flourishing at a national meeting that you attended a couple of years ago. So you came up with an idea for a study entitled Professional and Personal Well-Being Among Members of a Christian Organization for Healthcare Providers, a cross-sectional study. And that organization just happens to be the Christian Medical and Dental Association. So why CMDA in particular? I mean, yeah, you saw that we had some happy people who came to our national convention. Maybe that was a little self-selection, those who are willing to come to the national meeting. But were you looking for a group of Christians in healthcare before you went to that meeting, or just this is an idea that popped in your head when you started meeting CMDA members at a national convention?
I think we had an inkling of this being something we wanted to do, but we didn't have an audience like CMDA, people who were sufficiently committed to the organization and to their work that set them apart in many ways, we thought, from the general population. And we thought, it'd be worth exploring that and in a very a strict way of researching, and you guys agreed, and so we began to get underway. And Bert was a big help, as was Ann Sin,
with our coaching ministry, yes,
as well.
So, Carla, I want to ask you. So, you've obviously been very integral to this project and this publication, this study. And let's just jump right into it. I heard from Pastor Bert's own mouth, and he used 3 words with me that I'm not going to steal from you. I'll let you say those 3 words that were associated with well-being. And when I heard them, they stuck immediately, and I've shared them with groups of people, and like, yes, that's CMDA. That's CMDA. So why don't you share what your study, this study of 400 plus of our members who took the survey, what it showed?
Well, I'm going to give a little context to that, Mike. We had initially started out just with the question of what is the burnout level among members of CMDA. But it broadened to the question of, even if we find out that they are less burned out, will we know why? And so we added more questions that would help us understand that if we found a difference, we would understand what the difference was, not just that there was a difference. And what we did find out was very exciting. There were many results, and I know you're going to bring that up later, but the one that was most fascinating is that 3 items appear to travel together. That's belonging, calling, and virtue, meaning that if one goes up, the others go up, that they may be protective and augmenting of each other. So that was an entirely new concept that we hadn't planned on finding. So that was exciting.
Tell us just about this population of those who completed the survey, so we kind of know who you associate calling, belonging, and virtue with, who actually contributed.
So those were the members of the CMDA who were willing to fill out the survey, and approximately 50% of them are between the ages of 56 and 75. So they're both practicing and retired in that group, and the rest were younger than that. And mostly non-Hispanic, non-Latino, and physicians and DOs and dentists, but the 63% were those who are in the MD-DO category. So it's very much the representation in CMDA.
So you talk about general burnout rates in the general population of healthcare professionals, and what is that general rate believed to be about the time of the study?
Yeah, I'm going to pass that to Ted.
Okay, Ted?
So the earliest studies, going back more than a decade, showed that somewhere just under half of the physicians practicing in this country were, by their own admission burning out in medicine. So there's something like 850,000 practicing physicians in the country as of today. And if 48% of them are burnt out or burning out, that's a big number. That's a number of 400,000 or so of our doctors who are showing up for work every day and doing not only hard work, but precise work and work that's essential for today's modern healthcare. And yet they are feeling tired from what they do. They're not sure that it's making the difference that they wish, and work for many of them becomes not so much caring for a patient, but checking a box. So during COVID, those numbers actually went up, as one might anticipate, to well over 50% of our doctors in the country would admit to being burned out. That's dropped back considerably, back to about the 45% range. And I'll leave the results from the CMDA to Carla to tell you where that turned out on the scale. And I think you'll be very happy to hear that.
Fire away, Dr. Park.
So we discovered that those who participated in this study were very statistically significantly lower in burnout than the general population. And so, it's not, we can't go so far as to say Christian physicians are less burned out, but we can say that the group, the CMDA group, is less burned out than the average population. So that's interesting, and it certainly raises the question. And we saw some other indicators in the research that are suggesting that it perhaps is larger than just the group that was doing the research. But technically, we can say it's at least that group has less burnout.
So for either one of you, how do positive religious coping strategies as well as negative coping strategies influence mental health outcomes like anxiety or depression? And then what practical advice, since you've got massive numbers of healthcare professionals that you're responsible for, what advice would you give to foster positive coping relationships?
Well, a couple of things come to mind. As you know, Mike, doctors aren't very good at taking care of themselves. They'll take care of others until they're worn out, and they'll go home and they'll come back tomorrow and do the same thing. But they're not at all good at taking care of themselves. Doctors will first of all self-diagnose and then self-treat. And when that doesn't work, they'll stop a colleague in the hallway and say, Mike, I've got a patient who's got a problem with their back and it's not getting better. What could you recommend? So we do that, and when that doesn't work so well, as a last resort, we go to a real doctor and admit that there are things going on in their physical, mental, or emotional selves that just isn't going well, and they need to get professional help. But it takes some time for a doctor to get there.
Yeah. Just as a story, Mike, if you don't mind, I once saw a physician who was taking care of a woman who had hyperemesis. She was pregnant and she couldn't stop throwing up. And he took care of her so beautifully and so gently. And I'll never forget when he was praying around the bed for her. She wondered how this doctor could be so wonderfully kind. What she didn't know is that just before walking into that room, he had told me, he said, Carla, I need to tell you before I walk into this room that my own baby died. And he said, in order to sort of deal with my patient, I've got to tell you this. And I said, what do we do now? He said, we just go into the room and love her well. It was such a beautiful moment that it helped me see what we found in the research, that those who are practicing their own spiritual practices are equipped to care deeply for others. And very specifically, we found that those who are having daily spiritual experiences, those who are engaged in private religious practices such as prayer and those kinds of things, those who have positive religious coping, not so much related to organized religion, interestingly, but in your group, those who were having those private, deeply developing formative practices were exhibiting this kind of ability to reach beyond themselves for others and deal better with burnout. And it also related to the happiness scale and other things. But it's a powerful thing that happens when these daily developmental things are going on spiritually.
So that's interesting. You talked about formal, I think you referred to formal religious practices, but I also, that word belonging to me, calling, belonging, and virtue, the belonging seems like community, does it not? So what is it about your study that measured, what does belonging look like from what you found in your study among these participants?
So just a quick word on that. It's we didn't test the need to belong, which is very often what gets tested in surveys. We actually tested a person's belongingness. In other words, do they feel like they belong in the world? Do they belong to themselves? Do they have a right to be here in the world? And that's, of course, related to attachment and a lot of other things. But that sense of belongingness in the world predicted lower burnout, but also predicted a resilience and some other things. So that was an interesting finding.
So your questions, Carla, were not necessarily related to being part of a fellowship or a community. It was a little bit more ethereal, a little bit more broader than that to your question. Is that right?
Yes. So that was part of it, but not the main part of it. Because what's interesting is people who have a sense of belongingness want to belong and will tend to belong to a community and feel that they belong. Whereas those who don't have that within themselves, they might not care to belong or want to belong or be worried if they don't belong.
Ted, any comments on that?
Yes. One thing that is difficult for doctors to do is to seek help when they need it. It's even harder to have a close colleague whom you know is struggling with something. It may be substance issues. It may be relational issues at home. It may be a physical or mental ailment that they just won't talk about. And doctors often aren't prepared to address a colleague about what's going on. Mike, would you like to go to the lounge and have a cup of coffee? I'd like to hear what's going on in your life. That's hard for doctors to do, but so important, because if a peer is not comfortable doing that, chances are nobody else is willing to come to the table on that either, because after all, this is a doctor. So I think one of the things that is important in this issue of belonging and the issue of even virtue to some degree is to be able to say to a colleague, you just don't seem to be yourself. Can we talk about that a bit? really, I think, extremely important and far more effective than some of the other things that might or might not be available.
Feeling burned out in your healthcare calling? CMDA's team of highly experienced professional coaches is here to walk with you, offering personalized, faith-based coaching to help you heal from burnout, grow, and reconnect with God in the midst of your work. Take the next step toward renewed clarity, professional growth, sustainable impact, and a deeper walk with God by reaching out to cmda.org/coaching or send an email to coaching@cmda.org. And don't forget to mark your calendar for the 2026 CMDA National Convention, April 23rd to 26th in Loveland, Colorado. Join more than 1,000 Christian healthcare professionals from across the globe as we lean into Psalm 121. Lift up your eyes, enjoying community, gaining clarity on today's cultural challenges, and being equipped to stand firm for biblical truth. We'll be offering CE and CME credits, and we've got an incredible slate of speakers. Find all the details and registration in the show notes or visit natcon.cmda.org.
Dr. Park, Ted just brought up virtue. I'm just curious, having read through the paper and so forth, tell our listeners, how did you assess virtue in the respondents? What's the definition of virtue, and then how did you figure it out?
So virtue has to do with one's sense of character and moral resilience to their own moral code. So a high virtue rating would be those who have a sense of, and that's why probably it connects so much to calling, who have a sense of a way they should be in the world and they follow it. And just going back to the story that I mentioned, it's a man who believes that no matter what happens here in his life, he still ought to care deeply for another human being. And so that's that deep virtue, character, moral code that a person continues to adhere to, in spite of circumstances.
Driven by a strong conscience, intact, very vibrant conscience. So the calling factor, the concept of calling, I guess it emerged as quite a significant factor in reducing burnout. How can healthcare professionals cultivate or reconnect with a sense of calling in their work, especially during challenging times? And I like, one of my favorite authors is Os Guinness, and he wrote a book called The Call, and points to those people who don't believe there's a God, who, it's only a materialist world. I mean, how can you talk about calling if there's not a caller? There needs to be a caller if there's a call. But how can that whole sense of reconnecting, getting back to that sense of call, which has to be so ubiquitous within those who would call themselves Christians and decide to go into healthcare? How do we rediscover calling? Clearly high incidence of burnout, and there's burnout among the respondents. I mean, it wasn't zero. So our listeners, it's not like this isn't a problem for those who are hearing this faith in healthcare. So your thoughts as you've worked with healthcare professionals within faith, without outside faith, to rediscover calling, if indeed that is associated with a greater sense of well-being and less burnout.
It goes back to Maslach's burnout inventory, with the three major characteristics there of just being worn out, with not much to give, at least in terms of the more esoteric things. Maybe you're still doing surgery and doing it as well as you ever did it, but you don't have anything left to give emotionally or spiritually, and it's those are the elements of calling. Calling is not just being a very skilled mechanic, but it's being a person who can regardless of the circumstances, come alongside another person, a family member, a patient, a colleague, and be able to say, how can I help? What can I do? Uh, what what is really hurting the most, and how can we together work on that? And that calling results in a far more a far more caring individual, for whom caring is part and parcel of their practice.
And I'd like to comment on that as well, Mike. The idea of you mentioned a calling must have a caller. And in a Christian perspective, of course, we see that. Um, what's interesting in the question is that people who aren't people of faith will understand the concept of calling through a coherence between the sense of meaning, passion, and a driven, that they are driven or called internally to do a work that has coherence with their personality. So that may not be an external caller, but there's a sense of internal coherence about it. But when you feel called by the external caller of love, that what we would suggest that deepens that sense of a calling. But just going back to what Ted said, the really sad part about it is that even when people are called into medicine, if they're burned out, they will sometimes lose sight of that deep calling. And that is that's a challenging place to be.
Well, you also discovered an association between forgiveness, the presence of forgiveness, or the respondent describing that they've given forgiveness. I don't believe it was about experiencing forgiveness. It was about the willingness to extend forgiveness. And I've never seen that discussed in the well-being literature myself. So I'd like you to unpack that, one or both of you. How you assess this in the instrument, the survey instrument, what that looked like for the CMDA members who participated. Carla, you want to tackle it?
Okay. Well, the fun thing about Ted's dream about looking at the larger picture is what is helping us answer this question. So when you look at one's capacity to forgive, it takes someone who's stable within themselves, and they don't feel like they're going to be broken or fragmented apart by forgiving the other person. It takes someone who has a deep moral code that forgiveness is important. It has someone whose happiness is not going to be, thrown away because of it. It needs someone who has a deep sense of calling that they need to forgive. So all of these factors are sort of moving together. So it's enabling this person who has all of those things to be able to forgive and want to forgive. So that's what's beautiful about all these factors and this sense of belonging. I belong to God, who is the great forgiver, so I must forgive.
Yes, forgiveness is such an important thing. One of the most difficult things, I think, for physicians is to forgive oneself. Um, if you have made a mistake, or even if you've not made a significant mistake, but the character of the malady that you're treating is not amenable to the toolbox that you bring to work every day, and the outcome is not what you would have hoped it to be, how does a doctor forgive oneself? I think is remarkably important and very often overlooked until it just kind of wears its way out and you don't have to think about it every hour of every day.
I suspect, Dr. Hamilton, that those who've just heard you say those words, it only takes me a split second when I hear you talk about forgiving myself, that images pass through my brain from 25 years of surgical practice, both in Africa as well as in Michigan, and several patients. I mean, face it, whether it's technical or cognitive work that you're doing with patients, you do make mistakes. I mean, we just cannot avoid not seeing things, or technically not passing the suture in a good way, or whatever, and moral injury. I mean, moral stress and moral injury over the fact that I made a mistake and someone suffered because of that, and contributing to burnout. So thank you for talking about forgiveness. And so in AdventHealth, Carla, what do you have available for your staff? Who's available for your staff when they finally get to the point, maybe the colleagues, Ted, aren't providing the help because they're too busy looking at their watches. Wait a second, I can't spend a half an hour helping you forgive yourself, to figure out how to do that. Carla, what's available?
So Ted would speak to this well. We consider here at AdventHealth the chief spiritual officer to be the CEO, interestingly. The chaplain comes after that, but the CEO is the chief spiritual officer and is asked to lead the way, to care and to make sure there's care, spiritual care for all of those that report up. So the chaplains figure in very deeply there, and they're expected to care as much for for clinicians and providers and physicians as they are patients. So that's available. There's also psychological help available. And we have what's called a program called Creation Life, which brings a whole set of lifestyle issues to bear on a person's life. So there's a variety of things, and we can do better as well to take care of, because we're trying to figure that out right now. Our burnout rate is not as high as in some other places, and we're happy for that. But at the same time, it's higher than we would like it to be. And so we are engaging physicians in that question. But that's where Dr. Hamilton can weigh in.
Ted?
So yeah, I would like to take a crack at that. It's probably been some 20 years ago that the leaders of our medical staff came to me in my role at that time. I think we called it medical director. Today, one would call it a chief medical officer. But the medical staff folk came to me and said, we've had some really not good things have gone on here. And we think our organization needs some kind of a professional policy. We ended up calling ours a citizenship policy that allows reporting of doctor misbehavior to the office of the medical director, so that we can begin to get control of this. Well, we did. We consulted with a medical legal firm to help us put that together, and also a process for folk, either patients or nurses or other folk, to report, like an incident report in the hospital, to my office. And almost immediately, I began seeing about 2 doctors a week coming in for one reason or another that had been reported to my office. When I told our CEO at the time about this and getting it underway, he said, it's a good thing. I'm glad you've done it. It needed to be done. But he said, I'm wondering if we can't do something to lift doctors' shoulders, to lift their shoulders as they go about their daily work. We started thinking about that, and this was before we had data on burnout. but we hired a psychologist and a chaplain to work together to deal with physicians who had somehow stepped on someone's toes or were having difficulty with their daily duties. And we set it up in a way that it was free, it was confidential, and we set up even the office in a way that patients came in one door, saw the professional, and walked out another door, so that nobody else would see them coming in to see the psychologist or the chaplain. Um, it just became very, very successful because there was a real need there, and many doctors were helped to work through the issues they were facing by this combination of emotional, psychological, spiritual work by virtue of the way we had organized it. One brief little story. AdventHealth has quite a large hospital, actually today 5 hospitals, but then one big one in Kansas City. And the chaplain there was a farmer from South Florida, like Okeechobee, and his family had a farm there. And he decided he wanted to be in the ministry, and went through divinity school and came there as their chief chaplain. And he said, in a recent week, I had 2 separate doctors walk into my office different times, sit down on a chair, and each of them had a very similar story. My dog died this week, and I can hardly get up and go to work. It so affected me. I've just never forgotten that. Having a listening ear, a safe listening ear, in the chaplain's office or in the psychologist's office has been an incredible blessing to the institution over the years. And when I was chief mission officer, I encouraged our chaplains to think of their role not as exclusively patients, but think about the staff that you work with on that unit every day, the nurses, the doctors. You are a safe person for them to come to talk to bear their soul to, and that's incredibly important.
You know, Dr. Hamilton, and then I'll ask you, Dr. Park. I've been at the AdventHealth System Hospital in Tampa and had the privilege of sharing at a white coat ceremony, I think the first in that hospital, and met many different faculty and residents from different faiths, Hindu, Muslim. And I just wonder, because of your experience with these other faiths, what you think this applicability of the findings in this study for Christians and the protective effect of their faith on flourishing and burnout, how that might be transferable, or you're going to have to do another study to figure out whether their faith is protective, their practice is protective of their practice and from burnout.
So as you would know, Mike, you've practiced any number of places. At our hospitals, and particularly the larger ones, but often it may be smaller ones in rural areas, there are significant numbers of physicians on staff who are Hindu or Muslim, or even in smaller numbers actually, but significant Buddhist, and they go about their work. They're trained often in American institutions, and they appreciate we are a faith-based Christian organization. The Hindu doctors like our food. The Muslim doctors like having a place where they can pray. Buddhist doctors are just make peace with them, and they do just fine. But we are unapologetically a faith-based Christian organization. But if we're going to take the best care of our communities, we have to be open to doctors who can care for Buddhist patients and Hindu patients and Muslim patients. So that's part of reality today.
Dr. Park, your comments on that?
I remember back many years when a flurry of research on forgiveness came out, and it raised the question, well, is the concept of forgiveness, is it a Christian idea? Is it a religious idea? Is it a psychological construct? And the answer to all of it was yes, 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 and yes. It's like we had found a concept that everyone could understand, and each of the disciplines were claiming it. I think that's an issue of language. If we could figure out how to speak in a language that we all can at least understand facets of, then it works for people. So the idea of a calling, the idea of life satisfaction and what makes that, happiness, those are all concepts that people of a variety of faiths, and I've even tested some of this on people who identify as atheists. They can identify with these concepts from a different perspective. So I think the research really suggests that it should be replicated with a variety of groups and should dig deeper into the concepts of belonging, calling, virtue, because other groups outside Christians have those concepts that they're working with. Will they test out the same? We don't know. But it's a question that's worth asking in other groups.
So, Doctor, let me close by asking this question for both of you, because great conversation, important. It's encouraging that our faith makes a difference as healthcare professionals with all the stresses that we face and disappointments and challenges, and yes, dogs who die on us, during the week. So, what would be an actionable takeaway for our listeners or watchers in terms of what you learned from this study and the kind of practices, the understanding of faith as we take care of patients and each other? What would you suggest to our listeners at this point in time? And I'll start with you, Carla.
I think according to the research that came out of this group, a wonderful group to do this research with, we found that those who stop, pray, read, have these daily practices are forming a heart that is deeply satisfied and finds deep meaning in work. And to continue stopping and asking oneself, what was my calling, and am I still loyal to it? And what is my character, and am I working according to my moral code? And who do I belong to? And am I making sure my belongingness in the world isn't compromised? These are all things that make for an amazing career in medicine.
Dr. Hamilton?
I would say this: don't forget why you came into this profession in the first place. Hang on to that, even if you're busy, even if life has changed in significant ways for you. Hang on to those initial aspirations that brought you to medicine. Care for yourself and care for each other. It's hard to care for each other if you don't care for yourself, but both of those are important. And I think we've covered the rest of the waterfront on that.
My understanding from Pastor Burt Jones is that you plan on doing other sort of studies that come out of this. You have other ideas. What can you give me any insight into what that looks like? If there's what comes next for either one of you in this whole topic of faith and well-being?
Well, this is like the gold mine, right? It's like we found also in this research that your group is those who are that it relates to less depression, more life satisfaction, less burnout. There's all kinds of wonderful things going on. So you can't help but want to move forward and say, how could we more deeply study calling? What is that? At what age do people feel that? How do they know they're called? And what how does it how what threatens the sense of a calling? You can't help but ask, what could we do as a group to make people feel like they belong more? And what are we doing that causes people to feel they belong less? And when are we causing moral injury, Mike? Like you mentioned, I think we're scared to talk about, I know I am, about the times when I feel like I've been hurt morally, and those are deep wounds. And so this is the kind of research we should take forward, not just research, but writing about it and talking about it.
Oh, I'm excited about that line of research. So we're going to need to stay in touch about that idea. Well, for all of you listening, we've been discussing professional and personal well-being among members of a Christian organization for healthcare professionals. That happens to be CMDA, a cross-sectional study. And I want to thank you. I'm sure there were many, 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 many hours of time invested by both of you to make this study happen. And God bless you both. And that was published in the journal Religions, I see. Is that correct?
Religions, I think, is the name of that.
Yeah,
journal.
Religions 2025. So, all right. God bless you. I hope to have you, one or both of you, back sometime.
Thank you.
Dr. Ted Hamilton and Dr. Carla Park offered a wise, hope-filled conversation showing us that belonging, calling, and virtue can guard the hearts of those who care for others. They also shared simple, life-giving practices to build daily rhythms of prayer and scripture and reflection, to practice repentance and forgiveness, and invest in community and mentoring so that none of us walks alone. That vision sits at the heart of our CMDA mission. And speaking of mission, we'd love to see you at the Global Missions Health Conference, the world's largest gathering for healthcare missions. Whether you're a student who's exploring your first trip or a seasoned clinician leading teams, come to be equipped and encouraged through the plenary sessions, practical breakouts, exhibitors, and many new friendships. It's November 6th through the 8th, 2025 in Louisville, Kentucky. You can tap the link in our show notes today to get all the details, or just visit cmda.org/events. You know, CMDA exists to equip and encourage healthcare professionals to live out our faith with courage as well as compassion, just like Christ. If you're not yet part of this community, we would love to welcome you. Together we can stand firm, support one another, mentor the next generation, and bring the hope and healing of Jesus Christ to all the earth. You know, it's very easy to become part of this movement of Christ followers in the U.S. healthcare space. You can just go to cmda.org/join and become a member today. Friends, if today's episode encouraged you, please share it with a colleague and follow Faith in Healthcare on socials to stay connected. For resources, events, mentoring opportunities, and well-being support, just visit our main webpage at cmda.org. Well, next week, our guest is all the way from Egypt, whom I had the pleasure of interviewing while attending the Doctors with a Mission conference in Cairo not long ago. Dr. Greta Gamal is a pediatric specialist and director of operations for the Christian Medical Fellowship in Egypt. She shares with us how Christ followers are serving all across Egypt, about mentoring young doctors in training, and leading medical outreaches that bring whole person care, physical, emotional, and spiritual, to many underserved communities. I'm also going to reflect on the transformational impact of CMDA in the U.S. and abroad when healthcare professionals are equipped to live their calling with courage, compassion, and excellence. You don't want to miss this glimpse of what God is doing through healthcare professionals in the Middle East and beyond. I want to thank you for listening today to Faith in Healthcare, the weekly podcast from the Christian Medical and Dental Associations, where our mission remains the same, bringing the hope and healing of Christ to our world through committed Christ followers in healthcare. That's what always matters to us at CMDA. May you recognize this week that the Lord is with you and that He is for you to do His good work. Thanks for listening, and we'll see you next time, Lord willing, on Faith in Healthcare.